One of the most confusing things to patients is how they can rejuvenate their breasts with a breast implant versus a breast lift versus sometimes doing those together. Caroline, what do you tell your patients?
The first thing I ask my patients is, do you want to be bigger? And if a patient tells me, I'm really happy with my cup size, I'm already almost a D, then we have to just look at the tissues and see what's going on. Maybe it's really that they need a lift. They're unhappy when they take their bra off and their breast falls. For a patient who's really lost volume and they want to be larger, then I'd probably start with an augmentation.
I think one of the things that patients come in worried about is not only the appearance of their breast, but the feel of their breast. And after kids, sometimes the breasts are a little more jiggly or a little more floppy than they'd like. And that's one of the things that's very difficult for us to fix. I think we can fix shape. We can get the nipple at the top of the mound with a lift, but I absolutely agree with you that if they don't want to be bigger, then don't do an implant.
Are you happy with your size? Because a lift will not increase your size. And are you happy with the position of your nipple? Because an implant will not change that. So if you want to be larger, you're going to need an implant. If you want to move the nipple, you're going to need a lift. And if you want to do both, you're going to need both.
The one thing that everybody usually likes to restore is the fullness in the upper part of the breast. And in the right patient, an implant and a breast lift can work quite well, don't you think, Kevin?
I think it does. But remember, when you're taking that breast that has stretchy skin that has made it droop, we're trying to make it heavier by putting a small implant to get that little upper pole pop, that nice roundness that they may want.
Some people believe that this procedure should be done together, all in one stage. Some people think it should be done in 2 stages. Some people do it both ways. What do you think about that?
I think mastopexies don't necessarily last a lifetime, and before I'm going to put those scars on a woman that she has to look at every time she gets out of the shower and looks in the mirror, I really want to make sure we need that stage. So what I like to do is start with an augmentation first, let them live with it for a short period of time and decide if they want to add those scars.
And Rich, you know, we can do some measurements, right, to help guide the procedure.
In the consultation, we can know pretty much ahead of time whether the patient is going to benefit from a lift. And I think that the old school teaching was to separate the implant from the lift. But I think we've learned that we can safely do them in the majority of cases at the same time.
You can safely do them, but do your complication rates go up? Okay, and so the data is out there and some really good literature has been published, and the complication rates that some people might think is acceptable is up in the 25 to 30% range at 3 years. I don't think that's acceptable. I don't think that you should increase your risk of complications and revisions, and that I think if you do separate them out, you can have much lower complication rates.
Well, I think it's great information, and if you're interested in more of this, you can see that at theplasticsurgerychannel.com.